Should you undergo surgery for pancreatic serous cystadenoma? When considering whether to undergo surgery for pancreatic serous cystadenoma, it is essential to understand what this condition entails. Pancreatic serous cystadenoma is generally a benign tumor of the pancreas. It has a very low chance of becoming cancerous. Because of this, surgery is not automatically recommended for everyone diagnosed with this condition. The choice to have surgery largely depends on several factors, including whether the cystadenoma is causing symptoms, its size, growth behavior, and any uncertainty in diagnosis. If a patient experiences symptoms such as abdominal pain, feeling full quickly, or issues with nearby organs like the bile duct or stomach, surgery may be advised. These symptoms can significantly affect a person's quality of life and lead to complications, making surgical intervention a reasonable option. The size of the cystadenoma is another critical factor. Larger cysts, particularly those over 4 centimeters, may grow more quickly and could lead to symptoms over time. Some medical guidelines suggest considering surgery for asymptomatic cystadenomas larger than this size due to the increased risk of developing symptoms later. However, size alone does not guarantee that surgery is necessary. Diagnostic uncertainty also plays a role in the decision-making process. If imaging tests do not clearly differentiate a serous cystadenoma from other cystic tumors that might be malignant, surgical removal may be recommended. This is crucial because, while serous cystadenomas are benign, other cystic lesions can have the potential to be cancerous. For small, asymptomatic serous cystadenomas that show typical features on imaging, most guidelines recommend careful observation instead of immediate surgery. These small cysts rarely progress to cancer and often remain stable for years. It is also important to consider the risks associated with pancreatic surgery. These can include bleeding, infection, and issues related to pancreatic function. Larger tumors or delays in surgery can complicate the procedure and increase risks. In some cases, minimally invasive techniques may be available, which can help reduce recovery time. Guidelines from various health organizations provide further clarity. The American College of Gastroenterology generally advises against surgery or follow-up for asymptomatic cystadenomas. European guidelines suggest monitoring and only considering surgery if symptoms arise or if there is obstruction. Some experts recommend surgery for asymptomatic cysts larger than 4 centimeters due to the higher risk of symptoms. In summary, surgery for pancreatic serous cystadenoma is typically reserved for those with symptoms, larger or rapidly growing tumors, or when there is uncertainty regarding malignancy. For most patients with small, asymptomatic cystadenomas, careful monitoring is the preferred approach to avoid unnecessary surgery and its associated risks. Each decision should be personalized, made in consultation with a medical team that includes specialists in gastroenterology, radiology, and pancreatic surgery. This ensures a balanced approach that weighs the benefits and risks while prioritizing patient safety and health.